Hi, it's Helen from Nurturing Nurses. I'm just here today to go through a demonstration with you around burping and winding your baby. So, regardless of the method that you've chosen to feed your baby, so that could be breastfeeding or bottle feeding, it's really important that you do wind your baby correctly afterwards. Now, there are some myths out there that breastfed babies don't need to be winded. They absolutely do, because any form of digestion in the stomach releases gas. So we have to get rid of that one way or another for the baby. So obviously I can't demonstrate breastfeeding with you today. So I'm just going to talk a little bit about bottle feeding. So when you are bottle feeding your baby, there's a couple of ways that you can sit with your baby. So some people like to have them in their arms and sort of semi-upright to give them the bottle. Other people like to sit with the baby looking sort of towards them to feed. And I have to say that's probably my preferred method. Now, in order to feed your baby, you do need to have a little burpee cloth, winding cloth, whatever it is that you're going to use, just to pop over your baby, because it is quite normal that they do have a little bit of a posit, or a little bit of a spit up after a feed when you burp them. That's completely normal, and it's not sort of classed as a vomit, which isn't normal after a feed. So it's good to have that little bit there to protect baby and to protect your clothing as well. If you're using a bottle, there's various different teats that you can get out there on the market. There's slow flow teats, which we use a lot with premature babies. There are standard flow teats, and there are some fast flow teats. So we would recommend, obviously, with a newborn, starting off with a slow flow or a standard teat. And when you're feeding your baby, obviously sit in the preferred way that you want, either like this or like this, as I showed earlier. And what you need to do with your bottle is firstly make sure that the lid's on tight, because if it's not, then there's more chance that there's going to be air getting inside of that teat. And what you need to do, I'm just going to show you with the camera here, is make sure that that teat is completely full when you're feeding your baby. So you need to have the bottle up at a good angle. If you have it down like this, you can see that that teat is not completely full of milk. It's probably 2/3 to a half full of air. So that means that each time your baby sucks from the teat and swallows, they're not only going to get milk, but they're going to get a large amount of air. So if you can reduce the amount of air in the teat, then obviously you're reducing the amount that your baby's going to take in. So you would hold this in your baby's mouth and keep in the teat full. Let them feed. Sometimes babies will pause themselves. They might cough. And if that happens, then obviously you need to stop feeding, sit your baby up, and go through the burping technique. Some babies will take the full amount before they would actually stop and release the teat from their mouth and do a burp. But ideally, it's good to try and burp them at least once, if not twice, during their feed. So you would give them their feed in that upright position, and then you would pause and hold in under the baby's chin. Now, it's important that you hold them correctly, because what you're looking for is that nice straight back, because the straighter the back, the easier it is for the air to come out of the tummy. If we've got a baby that's folded up, it's very, very difficult for that air to then come out. So hold in the baby. You can support the back of the head if it's a newborn, and then you just need to be underneath their chin, not like this, because obviously that's going to restrict their breathing. You just need to be under the jaw here. Okay, and what we're going to do is sit them nice and straight, nice straight back, and we're going to rub up and down and around. Can do a couple of pats and then go around again. Now, sometimes you need to do this for quite a while, a good sort of minute or two before you get a burp. But at some point, your baby should burp and then relax a little bit. Now, that's a good call for you to continue. If they have finished feeding, then obviously you would stop there. But if they've had maybe half of that bottle, then you would go back to feeding them. So putting them back into that position, continuing on with the milk, filling the teat until they've finished the milk. And then we're going to come back up into this upright position and continue. Now, not everybody likes this position. It is my preferred position, but it's not everybody's. So what you can do, there's a couple of different positions that you can put the baby. So it's good to have a few of these burping cloths, or you can use a tea towel or a regular towel. Just pop it over the top of your shoulder. And then what you can do is pop your baby up over, and you can see baby's airways nice and clear. We've got that nice open mouth at the back there, and we can do the same thing. So we can do this gentle rubbing and a few pats, gentle rubbing and a few pats. Now you might see at this point that your baby's knees start to come up, and that's very, very normal if they've got air that's in there. So if you do have a nice burp that comes up and then the legs come down, that's a really, really nice thing to see, because it means that they're feeling a lot more comfortable in their stomach. Okay. Now, if you also do not like this position, or your baby doesn't like this position, you can actually pop your baby across your knee. So again, a nice little burpee cloth. Baby down on your knee, making sure that their mouth is clear for them to breathe, and you can wind them in this position. Okay, gentle pats and winding there. Now, if you are breastfeeding, obviously your baby is going to be in a slightly different position. So as opposed to being sat up or in our arm like this, your baby's actually obviously going to be across you. So once you've finished your feed, it's completely up to you. It's very quick and easy to just go up to this position. So a lot of mums who breastfeed do like to do this position, but equally you can have them on the breast, bring them off into that sitting position and up. So it's completely up to you, whichever you find the most easiest. Always remembering to keep that nice straight back, holding on to the jawline, and continue on until you get that nice burp. It's very satisfying at the end.